What is the primary function of the heart? Option 1. Pump blood throughout the body. Option 2. Regulate body temperature. Option 3. Filter toxins from blood. Option 4. Produce red blood cells. The answer is Option 1. Pump blood throughout the body. Who is known as the father of modern cardiology? Option 1. William Harvey. Option 2. Andreas Vesalius. Option 3. Harvey Cushing. Option 4. Henry Gray. The answer is Option 1. William Harvey. How many chambers does the human heart have? Option 1. 2. Option 2. 3. Option 3. 4. Option 4. 5. The answer is Option 3.4. Which part of the heart receives oxygenated blood? Option 1. Right atrium. Option 2. Left atrium. Option 3. Right ventricle. Option 4. Left ventricle. The answer is Option 2. Left atrium. What is the medical term for heart rate? Option 1. Pulse. Option 2. Cardiac cycle. Option 3. Myocardium. Option 4. Tachycardia. The answer is Option 1. Pulse. What is the function of the sinoatrial node? Option 1. Pump blood to the lungs. Option 2. Act as the pacemaker of the heart. Option 3. Prevent backflow of blood. Option 4. Control blood pressure. The answer is Option 2. Act as the pacemaker of the heart. Which blood vessels carry blood away from the heart? Option 1. Arteries. Option 2. Veins. Option 3. Capillaries. Option 4. Lymphatics. The answer is Option 1. Arteries. What separates the left and right sides of the heart? Option 1. Aorta. Option 2. Septum. Option 3. Valve. Option 4. Atrium. The answer is Option 2. Septum. What is the largest artery in the human body? Option 1. Pulmonary artery. Option 2. Aorta. Option 3. Coronary artery. Option 4. Carotid artery. The answer is Option 2. Aorta. What does the term myocardium refer to? Option 1. Heart valves. Option 2. Heart chambers. Option 3. Heart muscle. Option 4. Heart rhythm. The answer is Option 3. Heart muscle. Which side of the heart pumps blood to the lungs? Option 1. Left. Option 2. Right. Option 3. Both. Option 4. Neither. The answer is Option 2. Right. What is the term for the relaxation phase of the heart? Option 1. Systole. Option 2. Diastole. Option 3. Pulse. Option 4. Tachycardia. The answer is Option 2. Diastole. Who first described the circulatory system? Option 1. Leonardo da Vinci. Option 2. William Harvey. Option 3. Andreas Vesalius. Option 4. Henry Gray. The answer is Option 2. William Harvey. What is the purpose of heart valves? Option 1. To generate electrical impulses. Option 2. To prevent backflow of blood. Option 3. To contract the heart muscle. Option 4. To supply oxygen to the heart. The answer is Option 2. To prevent backflow of blood. Which chamber of the heart pumps blood to the aorta? Option 1. Right atrium. Option 2. Left atrium. Option 3. Right ventricle. Option 4. Left ventricle. The answer is Option 4. Left ventricle. What is the function of coronary arteries? Option 1. Supply blood to the heart muscle. Option 2. Remove waste from the body. Option 3. Regulate heart rate. Option 4. Pump blood to the lungs. The answer is Option 1. Supply blood to the heart muscle. What does tachycardia refer to? Option 1. Slow heart rate. Option 2. Fast heart rate. Option 3. Irregular heart rate. Option 4. Normal heart rate. The answer is Option 2. Fast heart rate. Which term describes the force exerted by circulating blood on the walls of the heart? Option 1. Cardiac output. Option 2. Blood pressure. Option 3. Stroke volume. Option 4. Pulse. The answer is Option 2. Blood pressure. Which part of the heart initiates the heartbeat? Option 1. AV node. Option 2. SA node. Option 3. Purkinje fibers. Option 4. Bundle of His. The answer is Option 2. SA node. What is the average resting heart rate for a healthy adult? Option 1. 30 to 50 bpm. Option 2. 60 to 100 bpm. Option 3. 100 to 120 bpm. Option 4. 120 to 150 bpm. The answer is Option 2.60 to 100 bpm. What does bradycardia refer to? Option 1. Slow heart rate. Option 2. Fast heart rate. Option 3. Normal heart rate. Option 4. Skipped heartbeats. The answer is Option 1. Slow heart rate. Which valve prevents blood from flowing back into the left ventricle? Option 1. Mitral valve. Option 2. Aortic valve. Option 3. Pulmonary valve. Option 4. Tricuspid valve. The answer is Option 2. Aortic valve. Which structure connects the atria to the ventricles? Option 1. SA node. Option 2. AV node. Option 3. Purkinje fibers. Option 4. Septum. The answer is Option 2. AV node. What is the role of the pulmonary veins? Option 1. Carry deoxygenated blood to the lungs. Option 2. Carry oxygenated blood to the heart. Option 3. Carry deoxygenated blood to the heart. Option 4. Carry oxygenated blood to the lungs. The answer is option 2. Carry oxygenated blood to the heart. Which layer of the heart is responsible for contraction? Option 1. Endocardium. Option 2. Myocardium. Option 3. Pericardium. Option 4. Epicardium. The answer is option 2. Myocardium. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life. Which chamber of the heart receives deoxygenated blood from the body? Option 1. Left atrium. Option 2. Right atrium. Option 3. Left ventricle. Option 4. Right ventricle. The answer is option 2. Right atrium. What is the function of the left ventricle? Option 1. Pump blood to the lungs. Option 2. Pump oxygenated blood to the body. Option 3. Receive deoxygenated blood from the body. Option 4. Pump blood to the right atrium. The answer is option 2. Pump oxygenated blood to the body. Which valve prevents backflow of blood into the right atrium? Option 1. Aortic valve. Option 2. Pulmonary valve. Option 3. Tricuspid valve. Option 4. Mitral valve. The answer is option 3. Tricuspid valve. What separates the left atrium from the left ventricle? Option 1. Aortic valve. Option 2. Mitral valve. Option 3. Tricuspid valve. Option 4. Pulmonary valve. The answer is option 2. Mitral valve. Which artery supplies oxygenated blood to the heart itself? Option 1. Pulmonary artery. Option 2. Aorta. Option 3. Coronary artery. Option 4. Carotid artery. The answer is option 3. Coronary artery. What is the role of the sinoatrial node? Option 1. Initiate the heartbeat. Option 2. Pump blood to the lungs. Option 3. Close the heart valves. Option 4. Prevent backflow of blood. The answer is option 1. Initiate the heartbeat. What is the name of the phase when the heart muscles contract? Option 1. Diastole. Option 2. Systole. Option 3. Hemostasis. Option 4. Ejection. The answer is option 2. Systole. Which structure carries electrical signals from the AV node to the ventricles? Option 1. SA node. Option 2. Bundle of His. Option 3. Purkinje fibers. Option 4. Coronary sinus. The answer is option 2. Bundle of His. Which part of the cardiac conduction system is located in the interventricular septum? Option 1. SA node. Option 2. AV node. Option 3. Bundle of His. Option 4. Purkinje fibers. The answer is option 3. Bundle of His. What occurs during ventricular diastole? Option 1. Ventricles contract. Option 2. Ventricles fill with blood. Option 3. Atria contract. Option 4. Aortic valve opens. The answer is option 2. Ventricles fill with blood. Which is the function of the pulmonary valve? Option 1. Prevent backflow into the left ventricle. Option 2. Allow blood flow into the pulmonary artery. Option 3. Prevent backflow into the right atrium. Option 4. Allow blood flow into the aorta. The answer is option 2. Allow blood flow into the pulmonary artery. Which is the largest vein in the human body? Option 1. Superior vena cava. Option 2. Inferior vena cava. Option 3. Pulmonary vein. Option 4. Coronary sinus. The answer is option 2. Inferior vena cava. Which phase of the cardiac cycle involves the closure of all heart valves? Option 1. Isovolumetric contraction. Option 2. Isovolumetric relaxation. Option 3. Ejection phase. Option 4. Filling phase. The answer is option 1. Isovolumetric contraction. What does the P wave in an ECG represent? Option 1. Atrial depolarization. Option 2. Ventricular depolarization. Option 3. Ventricular repolarization. Option 4. Atrial repolarization. The answer is option 1. Atrial depolarization. Which structure ensures rapid conduction of impulses to the ventricular walls? Option 1. SA node. Option 2. AV node. Option 3. Purkinje fibers. Option 4. Bundle of His. The answer is option 3. Purkinje fibers. Which is the normal range of cardiac output in an adult at rest? Option 1. 1 to 2 liters per minute. Option 2. 3 to 4 liters per minute. Option 3. 4 to 6 liters per minute. Option 4. 5 to 7 liters per minute. The answer is option 3.4 to 6 liters per minute. What causes the lub sound of the heartbeat? Option 1. Closure of semilunar valves. Option 2. Closure of atrioventricular valves. Option 3. Opening of semilunar valves. Option 4. Opening of atrioventricular valves. The answer is option 2. Closure of atrioventricular valves. What structure prevents prolapse of the atrioventricular valves? Option 1. Chordae tendineae. Option 2. Papillary muscles. Option 3. Semilunar valves. Option 4. Atrial walls. The answer is option 1. Chordae tendineae. What does the T wave in an ECG represent? Option 1. Atrial depolarization. Option 2. Ventricular depolarization. Option 3. Ventricular repolarization. Option 4. Atrial repolarization. The answer is Option 3. Ventricular repolarization. What is the purpose of the cardiac conduction system? Option 1. Transport oxygen. Option 2. Regulate blood pressure. Option 3. Generate and transmit electrical signals. Option 4. Control blood flow in veins. The answer is Option 3. Generate and transmit electrical signals. What occurs during atrial systole? Option 1. Atria contract. Option 2. Ventricles contract. Option 3. Aortic valve opens. Option 4. Ventricles fill with blood. The answer is Option 1. Atria contract. What is the purpose of the AV node? Option 1. Speed up electrical signals. Option 2. Delay electrical signals. Option 3. Generate electrical impulses. Option 4. Contract the ventricles. The answer is Option 2. Delay electrical signals. Which vessels bring oxygenated blood to the left atrium? Option 1. Pulmonary veins. Option 2. Pulmonary arteries. Option 3. Aorta. Option 4. Coronary arteries. The answer is Option 1. Pulmonary veins. What is the normal duration of the cardiac cycle? Option 1. 0.6 seconds. Option 2. 0.8 seconds. Option 3. 1.0 second. Option 4. 1.2 seconds. The answer is Option 2. 0.8 seconds. What is the role of the semilunar valves? Option 1. Prevent backflow into the atria. Option 2. Prevent backflow into the ventricles. Option 3. Regulate blood flow into the ventricles. Option 4. Regulate blood flow into the atria. The answer is Option 2. Prevent backflow into the ventricles. Convert text to speech, English to Tamil, Tamil to English. Do you need high-quality text-to-speech conversion? We provide clear, natural voice-overs for your needs. English to Tamil and Tamil to English. Professional audiobook creation. Drop your queries in the comments. Have a requirement? Message us now. Let's bring your words to life.